Hi dear friends, with you, Natalia on the Doctor Online channel, on which I share personal experience and answer your questions. Today we will talk with you about the secrets of successful treatment of rheumatoid arthritis. Rheumatoid arthritis is quite a serious disease characterized by the development of erosive destructive processes in the joints. However, nowadays, the reversibility of the development of pathological processes is recognized if active therapy is carried out at the early stages of the disease. In other words, the survival tactic in prescribing basic therapy has shifted to an aggressive one, which is prescribed immediately after the diagnosis is established. This is the first and perhaps the main secret of successful treatment of rheumatoid arthritis. The second secret to successful treatment of the disease today is a special approach to the treatment of pain and inflammation in the joints. If earlier non-steroidal anti-inflammatory drugs, for example, the well-known diclofenac, were prescribed for an indefinite period, today they are prescribed strictly individually, as necessary and with minimal courses, up to their single use. Why is the danger of their long-term use generally recognized? Because they all sooner or later cause ulcerative defects of the gastric mucosa. In addition, in the early stages of rheumatoid arthritis, they remove all symptoms of the disease, thereby masking the ongoing processes. In other words, they create the illusion of complete recovery. Because of this, as practice shows, the majority of patients refuse to continue basic therapy schemes. And the inevitable result of such a refusal is the progression of rheumatoid arthritis. The third secret of successful rheumatoid arthritis therapy is the appropriate and timely prescription of glucocorticoids. Hormonal drugs should not be feared and taken with a pinch of salt. After all, they not only quickly reduce pain and inflammation, but also slow down the destruction of cartilage and bone tissue in the joints. From my point of view, attention should be focused on three clinical situations in which the prescription of glucocorticoids is most justified. First of all, it's the presence of a pronounced pain syndrome, specifically of an inflammatory nature. Hormones do an excellent job with their task, relieving pain and inflammation and in the shortest possible time, after which they are immediately cancelled. Quite often, we prescribe glucocorticoids in the form of short courses. Let's move on. In severe cases, they need to be prescribed together with basic therapy means and primarily with methotrexate, the gold standard of basic therapy for rheumatoid arthritis. Moreover, as practice shows, when hormones are combined with methotrexate, you can kill two birds with one stone. Firstly, it gives the opportunity for methotrexate to work, and in reality, it only starts working 3 months after its prescription. In this case, hormones play the role of a bridge, ensuring effective pain relief until the effect of the basic therapy with methotrexate kicks in. Secondly, the combined prescription of hormones with methotrexate improves the tolerability of the latter, especially in the early stages. This is also very important in terms of the patient's adherence to long-term and sometimes aggressive therapy for rheumatoid arthritis. But there's no other way. It's important not to miss that brief window of time during which you can slow down and in some cases even reverse the autoimmune process. In recent years, rheumatologists are increasingly prescribing hormones in short courses at high doses, conducting so-called pulse therapy. This is justified in cases of severe systemic damage, as rheumatoid arthritis not only destroys joints, but also affects such vital organs as the heart, kidneys, liver, and other organs. By the way, for elderly people, for whom it is impossible to prescribe methotrexate and other basic therapy drugs due to a number of circumstances, it is recommended to prescribe glucocorticoids for long courses at low doses. The fourth secret of successful rheumatoid arthritis therapy is adequate physical activity. It is simply necessary to prevent the patient's immobility and the development of muscle atrophy. For this purpose, even during the exacerbation of the disease, the appointment of a suitable course of therapeutic physical culture is justified. In this case, as the condition improves, the volume of load significantly expands. The fifth secret of successful treatment of rheumatoid arthritis is the conduct of regular courses of massage and physiotherapy. Various types of orthoses are used to maintain the normal position of the extremities. Acquiring them at the present time is not a problem. However, their constant wearing is unacceptable. Remember this? You were with Dr. Savkina. Subscribe to my channel and stay healthy.